Yeah, reruns. Funny. All right, looks like we have a few people on board, so let's get started. So, as you probably have heard, because you got the word via email or social media, we are very proud to announce that we are now offering DAXXIFY. What is DAXXIFY, and why are we so proud to be offering it? Well, it's awesome, first of all. Second of all, we're pretty proud because we're one of only 1% of practices in the U.S. to be one of the first launch practices. So we have this exclusively for the next 3 months, and that gives us not only an opportunity presented to our patients, but a little bit more experience than other people who may not be as familiar with it. So DAXXIFY is a form of botulinum toxin, aka Botox. People are very familiar with Botox, and Botox is what we are going to use to compare this to, because it is the gold standard really for botulinum toxins. And today we're going to be talking about how DAXXIFY is new and different, and also what it can be used for. And as we go along, please just ask any questions that you have. But without further ado, we will jump in. And how I'm going to do this, I'm going to talk a little bit about the academic part of it, you know, the features that makes it different, how it works. Then we'll jump into some before and afters, so you can see it in patients' real experiences. Then we'll answer any questions. This is going to be a really short one. I don't think this will be a long presentation at all. So, what are some of the features that make DAXXIFY different and unique? So, first of all, top line there, right away, longer duration of results. How long? Well, we'll compare that in a little while, but 2 to 3 times basically what you're going to get out of Botox. No refrigeration needed. That may not be a big deal for us, because we are very careful about our refrigeration practices for other botulinum toxins. But it's always something that I've wondered. What if somebody forgot to refrigerate their Botox? You don't have to worry about that. It's shelf stable prior to reconstitution. For those people who are vegan, this happens to be a vegan product, so there are no animal-derived components at all, which is unique to DAXXIFY. Also, no human serum albumin. That's one of the protein carrier molecules that you'll find in other toxins. And it's made in the USA, which is always nice. This, to me, is going to be, if I were a patient, I would want to know, I'll zip myself down here, I'd want to know what's the cost and value difference. So I made this little chart, and you'll see here I've compared Botox and DAXXIFY, again, because Botox is our gold standard for comparison. So the duration. For most people, Botox is going to last about 3 months. And what do I mean by last? Well, the time which you see minimal or no wrinkles in the area that was treated. So typically that's about 3 months. It can be as much as 4 for some people, or even a little shorter for other people. DAXXIFY will be at least 6 months, but can be as long as 9 months. So that's 2 to 3 times as long as the duration of Botox. Okay, so that's good. For people who serially get Botox, like myself, I'm super excited about that. Just a couple times a year, I don't have to remember to get injections. Now, the cost part. So cost will vary, obviously, from practice to practice, but in general, DAXXIFY will be about 1.5 times as expensive. Treatment per treatment. We're going to talk about this. So if your typical treatment was $10, then your treatment's going to be $15, right? Obviously, extrapolate that, $100, $150. But it's 1.5x. However, it lasts 2 to 3 times as long. So the savings is really 20 to 50% increased in value that you're getting per botulinum toxin dollar. Hope that makes sense. I've really taken a lot of time to explain this, in a way that I think makes sense for people. If you're interested in value, like I am, I think most people are. Hi, Karen. So if anybody has any questions about that, I think I did a pretty good job explaining that. But please jump right in and ask any questions. All right. So now that I'm back up in the right upper hand corner, so I don't block anything, I'm going to explain the tricky part about DAXXIFY. Ashley, would the amount of units be the same? My goodness, it's like you're reading my mind because this next slide is going to talk exactly about that. So I'm going to give you a little thumbs up like on that because you're super cool and read my mind. All right. No. The answer is no. Oh my gosh, this is going to be the most confusing thing for patients, but I'm going to try to make this really simple. Strictly speaking, you need 2 units of DAXXIFY for every 1 unit of Botox. So you do need twice the number of units, okay? So just read what I wrote here. Example, if you needed 15 units of Botox for your glabellar lines, you'll now need 30 units of DAXXIFY. But to keep things simple, in our practices, and I think a lot of practitioners are going to be doing this, we're just going to talk in what we call Botox equivalent units. What does that mean? That means that 1 Botox equivalent unit is actually 2 units of DAXXIFY. So if you came in and said, I usually get 15 units of Botox here, I'm going to say, sure, no problem. We're going to give you 15 Botox equivalent units of DAXXIFY. But it's always 15, so you can just go in and say, hey, I got 30 last time, I got 15, I got 12, whatever, and you're going to get the equivalent dose of DAXXIFY. But in actuality, it's twice the number of units of DAXXIFY you're getting. But we're going to just think of it 1-to-1. That way, whatever you're used to getting with Botox, you're going to get the same number of units of DAXXIFY. That is what I was explaining before. So 2 units of DAXXIFY is really 1.5 times the cost of 1 unit of Botox. So as I said before, it's going to be your treatment that you get for the correct number of units for the effect that you want is going to be 1-to-1, and it'll be 1.5 times the cost of your Botox treatment, and it will be 2 to 3 times the longevity. But I don't want people to be confused. So if somebody is very specific and they want to know exactly how many actual DAXXIFY units, well, it's twice the number. Here's why I think this is going to get a little confusing. In our practice, to keep things simple for patients, we are going to market the cost as, well, I think the next slide talks about this. We're going to market the cost as, let's just say, $13 a unit for Botox, right? I'm going to read this out here about pricing, because pricing is important. You need to know what things cost. And I'm going to give you an example. I like how I misspelled practices there. We're going to change that in real time. That's what happens when you are making PowerPoints with 3 pets on your lap, all struggling for real estate on your lap with a laptop. And I love the animals so much that I never take them off. So I wind up just building a little mountain of pillows to the side and then typing on the side. So I make some errors sometimes. Okay, I digress. All right. So we've chosen to price our DAXXIFY in BEU. Okay. Other practices may charge you in actual DAXXIFY units. Why is this important? Okay. Well, let's say in our practice right here, practice A, might say that Botox is $13 a unit and DAXXIFY is $21 a unit. Okay. That's like us. To me, I think that's easy math, because if you want 10 units, you would either be $130 of Botox or you'd be $210 of DAXXIFY. You're going to get the same effect. It's just your DAXXIFY is going to last 2 to 3 times. Practice B might say, yes, our Botox per unit is $13, and our DAXXIFY is $10.50 a unit. And they mean actual DAXXIFY units. And this is where this is going to get confusing, because if you're shopping around, you're like, well, I'll go to that practice because it's half the price of Dr. Cappuccino's practice. No, not exactly. It's the exact same price. So you got to just clarify that, but just know in general terms across the country and actual units between $10 and $12, but the equivalent unit is going to be between $20 and $22 nationwide. And we're right there in the middle of that. So we've decided to just kind of go right in the middle, which we do with everything, to keep it accessible and fair to people. So just be aware that both practice A and practice B are charging the exact same price, but just qualify when you ask them, are you talking about individual DAXXIFY units or Botox equivalent units? And I think it's going to be pretty obvious as we go forward with this. But in our practice, just know that you're going to get the same treatment number of units. It will have the same effect. It's just going to last longer, and it'll cost a little more initially, but of course that value is going to be better. Now, that was a really long-winded, complex explanation, but I hope I made sense. So somebody just comment and let me know if that makes sense and if there are any questions and if I confuse anybody, but it's the best I can do with that. And now we'll nerd out a little bit. I will not spend too much time on this, but I want you to know why this is special and different. So the key properties, You have your basic 150 kilodalton neurotoxin. Okay, that's the same that you're going to find at your botulinum toxin. However, there are proprietary formulations that essentially stabilize the molecule and make it stick around in the cleft between our nerve and our synapse and our muscle fibers. And that's really what we think is going on. This next picture shows that there is a electrostatic charge, a positive charge that's unique to DAXXIFY. And that charge, we believe, helps it stick around longer in the synaptic cleft. So when our Botox wears off, our botulinum toxin wears off, in about 3 months, if you're using some of the other products, that's it, it's gone. But if we're using DAXXIFY, there's more sitting, waiting in the cleft attached to that membrane that will then go back in and act for another 3 or 6 months. Yes, Lisa, you should be excited to try this. I did try it, and I'm going to tell you what it's about and how it worked for me and what's kind of cool about it. The Secura program, you're getting information here that's really high level. These were the phase 3 clinical trials. And what I don't want to bore people, but just so you know how these products are tested, because we're becoming more savvy, and we should be, especially about things we're putting in our bodies. So there's a proof of concept, stage 1, very small number of people, 48 for 32 weeks. Okay, it works. Stage 2, phase 2, what is the correct dose? 268 people for 36 weeks. Okay, we figured that out. Phase 3, is it safe and does it work as long as it's supposed to be, right? And now we have 600 people in that study. And then finally, 2,700 people in the safety phase 3 part. So that's up to 84 weeks. So we've really tested this quite a long ways out multiple times. This very busy looking chart, what this is saying is for the participants in the trial, how long did it take for them to notice their lines coming back? Let's just look at it that way. Essentially, how long did it last? And how they're measuring that is, when did they lose the no movement or just slight movement? And that difference is because some people like to be frozen and some people like to move a little bit. But when did it wear off and they started to move and see wrinkles? Okay, so if we go out to 3 months, there's 12 weeks, we're up well above 90%. Now we go out to 4 months and we're still 80%, 85% of people at 4 months. And you go out to 6 months and we're still greater than 50% of people see no movement, or just starting to see some movement. And then it travels out to 36 weeks. But in generalities, most people are seeing between 6 and 9 months of effect. So there's that. Adverse effects, essentially, it's the same as all the other botulinum toxins that we have used in the past, namely headache, which is could be because of just injection pain, could be because we're straining to move those muscles that are now paralyzed. That's what I think. It doesn't happen to everybody. It doesn't happen every time. Typically, the first time or two that you've had a botulinum toxin, you'll see it. After that, you don't notice it. Of course, injection site pain, ouch, needles can hurt, can be red, can be swollen. Those are the main ones. And then the last one at the bottom there is eyelid ptosis, and that's if the toxin migrates into the upper eyelid. It can make that upper eyelid a little bit weak. Okay, it happens rarely. We see it every couple of years. So if it's done correctly and follow the post-injection instructions, it shouldn't be a problem. Fortunately, there are some medications we can give, eye drops that will reverse this a little bit, or at least compensate for it. But here's the good news: if you do get that droopy eyelid, it doesn't last for 6 to 9 months. It'll last for a few weeks, 2 to 3 weeks, and then it comes back to the point where we don't notice it. So that's good news. All right, almost at the end here. Now, I'm going to show you some pictures from the trial, and then I'll show you some of my own patients. So what we're looking at here at baseline on the left is just somebody frowning. They're squinting. They are firing their corrugator muscles in their glabella region. This is the most common area that people will want to get those angry 11 lines out, right? So here, this person is at week 4. Smooth, smooth, smooth. Week 16, so now we're at 4 months, and I mean just ever so slightly coming back. And then here we are out at 6 months and just barely making some motion. seems like a pretty good example where you can really see. And here's another example. So these are some really scowly, angry lines. This person must have been very happy. And then we have week 4, week 16, and all the way out to week 24. Now, what I want you to notice, because this has been something that is different with DAXXIFY. This is sort of a subjective thing. Yeah, thank you, Lisa. It is nice. Not only are we relaxing these lines, but people are noticing that their skin is smoothing out. Well, you're going to say, yeah, duh, of course it's smoothing out. That's the whole point. No, that's not what I mean. I don't mean that the lines are flattened or effaced. What I mean is their actual skin texture has smoothed out. Their pore size has gotten smaller. If you look in this week 4 as compared to the baseline, look right in the middle of her forehead. See how shiny it is? You see that light reflex off the flash? It's really cool, and I noticed it as well. So we're pretty impressed with this. Now I'm going to show you some of our pictures. I'm going to flip over to my folder here. So this is mine. I mean, this isn't super impressive because I'm somebody that keeps up on my Botox. And this is me at 2 weeks after my initial injection. So 2 weeks ago, and then this was today. You can see I'm wearing the same shirt. Adds to the authenticity of the presentation. And what you'll see is I don't have a lot of lines, but this was me on the left side here trying to lift my eyebrows up previous to the injections, and here I am today, and I like my brow position a lot. I don't look droopy, I don't look surprised, and my skin is certainly smoother. So that's me. Now some of my other test patients, for lack of a better name, who are very happy to get their treatment done. It's one of my favorite people here. She's awesome, and she's a super good patient. Didn't complain at all about the injections. And you can see she's very expressive and has a lot of lines in that upper forehead area. And then 2 weeks later, much smoother, much calmer. Now, arguably, we could put an extra unit or 2 in a couple spots to even things out, and we probably will. But we always like to give a couple weeks for things to really settle out before we make adjustments. And then here is a smiling picture. So we're looking at crow's feet. We don't want to paralyze these completely because people still want to be able to smile and express their joy. However, you can see that it's much, much smoother. Let me show you a couple other pictures here. This is the mother of one of our beloved employees, and she's like family here. So she was very excited to get treated. And you'll see her very expressive frown lines in there. And then 2 weeks later, really incredibly smooth. What a nice difference. We'll look at, this is the static picture, so no expression. I like this one a lot. This is an important one because at rest, we see these transverse forehead lines, and we see some finer lines along the glabella here. And then at rest, they're pretty much gone. That's really impressive after only 2 weeks. And then we compare that with the raising up the eyebrow expressive picture, where of course we expect to see a lot of folds in this point pre-treatment, and then afterwards really calm down. But take note, she's still moving her eyebrows. It's very important. She can still express. Let's go back to her resting picture. Okay, no expression. Surprise question mark face. You can certainly tell that she is expressing. However, lines aren't there. That's the mark of a really good treatment. So, in summary, DAXXIFY is a new botulinum toxin from Revance Therapeutics. They also make the RHA line of fillers, which we offer at our practice. It's going to last 2 to 3 times as long as our Botox. It's going to cost about 50% more per treatment. You'll have some added benefits of smoothing of the skin, it seems. Safety should be in line with other treatments with Botox and other neuromodulators. And we're one of 1% of practices right now that get to be launch practices exclusive for the first 3 months of this year, after which time I expect a lot of practices will be offering this because it's pretty awesome. So that concludes talk about DAXXIFY. If there are any final questions, go ahead and tap in. Otherwise, I will see you in the office. All right. Yeah, I'm looking forward to it too, actually. All right. See everybody later. Thanks for tuning in. Bye.